Welcome back to the Movement Professional Podcast. And here again with Megan Morley. How are you doing today, Megan?
I'm doing well. How are you doing, Chris?
I'm doing great. So I got very positive feedback for our last discussion. I'm glad we're doing another one. We alluded to at the end of last podcast that we were going to touch on chronic pain from both of our different perspectives, the perspective that we have in strength and conditioning, but also then my perspective as a physical therapist and yours as a counselor. And I think this is a really, really important topic because I think as we discussed last time is, we're a lot of times we're treating from these different scopes and we feel like we can't step on each other's toes, but ultimately there is a need for collaboration. And the psychology and social piece of helping people with pain in the physical therapy side of things is so important, but sometimes we might not be the best people to describe or discuss what needs to happen there. But we do need to know it better. So I think this collaboration, this discussion of where you're coming from with clients and where I'm coming from with clients can be very valuable here.
Absolutely. We can't, I think, underscore enough how connected pain is between the physical and the emotional, psychological, however you want to frame it. So absolutely.
Absolutely. So I think like the number one thing I try to get across to patients of late is that no matter what, pain is not the same thing as structural damage or injury. That doesn't mean that they're not related by any means. It just means it's never the same thing. And I think that's the idea of separating the two ideas out of like, what is an injury? An injury, we can actually, point to tissue damage. We can actually talk about healing processes and things like that. But that is separate from the pain that might be involved in an injury, but sometimes it's not. So I don't know if you watched the Jets-Bills game last night, but Aaron Rodgers, tore his Achilles, and that's an example there of a very common, very brutal injury in a way in sport because it's going to end your season, but it's often very painless. And you could see in his response last night, he wasn't in pain, but he knew something was wrong. Right. Mm-hmm. So that's to me a common example you see in sports and you see in other walks of life where there's an injury without pain. But what we tend to see, I think, in physical therapy is we see people, their biggest complaint is pain, and they may not have an injury anymore, or mm-hmm. they had an injury originally, but now it's, we're dealing with something else. So the, number one thing to, I think, get across is that there's always a different discussion, pain versus injury.
Absolutely. 100%. And that is one of the things that I talk about with people with chronic pain is, and it's not always me doing this education, but you need to be educated on what's actually happening in your body. You need to ask your physician, your PT, whatever the physical wellness provider that's working with you, you need to be educated about what is physically going on in your body so that we can start to tease out what is actually the structural issue going on, if there are any, and separate that from what is the psychological component or whatever else might be going on.
Absolutely. And I think with the idea of injury is sometimes you got to look at like the mechanism of what happened. And oftentimes like the acute nature of something will tell you how much it's connected to the injury that happened and how much it might be beyond the injury. So if it's a more chronic condition, and this is ultimately our discussion's more about chronic pain, which can be defined in different ways, but generally if it's about 3 months after the initial onset, we're talking about some chronic things. And oftentimes that manifests in different ways. It could just be, the same symptoms or similar symptoms from the onset, and they're just carrying over longer. A lot of times it's more episodic where you've had, no pain at some point in your life, you started having pain, and now you get these ebbs and flows in pain that can be just extended out, for throughout a lifetime sometimes. But the idea there is the farther you get from an initial mechanism of injury that you can kind of point to, the less likely it is a specific injury that has to go through a healing process. Mm-hmm. And the more kind of insidious the onset. So if you're not sure of what brought your symptoms on, it kind of came out of nowhere, as opposed to in a sports injury, as an example, or a weightlifting injury where, I felt a pop when I did this. All right. Mm-hmm. And that pop, is usually a sign that something happened to your structure. But it's not always, accompanied by pain, but there you can actually pinpoint that moment in time where you feel like something happened that's going to be more connected, where the structural damage and the pain may go closer together. But as you get farther from that initial injury, now we have to be talking about some other things that are just as important, if not more important.
Absolutely, absolutely. No, I definitely hear that. And also, then we get the other issues, and I'm sure we'll talk about this more as we go along, that start to layer in. The further away you get from that injury or the onset, whatever it is, then, people are starting to deal with anxiety or frustration or, some of these other components that, aren't necessarily physical at all, that start to lay in because they're exhausted and frustrated from having to deal with this for so long, and they just don't understand why this isn't going away or whatever the case may be.
Absolutely. And I think there becomes then a cycle of, what could be described as physiological problems with from a pain perspective, with psychological and social problems. And they often get described as separate things, but you could really see how they're just really like a cycle that is intertwined, right? So, if you are having some type of psychological anxiety, or if there's like a social component where your pain is getting in the way of you being able to do things with others, right? That is going to change your physiology. We can talk about the autonomic nervous system, which is your fight or flight response. We could talk about how there's, difference in muscle tension based on, threat response in your body. So all of that stuff is like physically happening. Really, like the biology of the human is changing through the nervous system and all that. But that it can often be triggered by different thoughts from a psychological standpoint, or by different threats in the social environment. And I think that's where, to me, at this point, like I try to get across that the idea of pain is more equivalent to threat or danger than it is to damage, right? And I think because then it ties in everything, right? It ties in all of these, these different specialties of what is the most threatening to you. And from a movement perspective too, it's really important that it's the client that is in charge of like telling you what's threatening, not you looking at them and say, "Ooh, that's threatening to me because you're not moving the way I want you to," but more like, do you feel that next weight is threatening, or are you okay there? Right. So that there's this sort of shared decision-making process.
Absolutely. I really like that. I hadn't ever framed it in that way, as a threat, but I really like that because it brings up something that comes up with my clients a lot, which especially if my client has been an athlete, whether it be like an active competitive athlete or like a forever athlete, somebody who's lifting, or whatever the case may be, is that like loss of identity, that loss of like what their regular life looks like, and the threat. And I really like assigning that word there. What threat does this have to how I perceive myself, how I view myself, what my identity is, and what that means about how I live my life? So I really like that frame up for a lot of different reasons. Absolutely.
Absolutely. And I think, that speaks to even some of the biology of pain, and how you can kind of describe it. Like we mentioned the fight or flight response, but then, in kind of neurology 101, usually you learn about something called a nociceptor that is like your pain receptor. And you learn it as a pain receptor, but like I feel like that needs to be defined even farther to say, like, what is the, like, receptor means it's responding to something in the environment, right? So what is it that actually that nociceptor is responding to? Like, it can't respond to pain because it kind of creates the pain. So what is it responding to? It's actually responding to threat, I think is a way that you can be thought of, because again, it's not necessarily a damage receptor. It doesn't respond to damage because you can have damage without having pain. So if you look at it again from a very physiological standpoint, you're seeing that these receptors in the body are being, they're being stimulated by some type of threat in the environment. So if you are someone who is in a state of things are more threatening on a regular basis, then you're closer to pain on a regular basis. And there, certainly some type of absolute like acute trauma will get you closer to that. But like we have to look at it as like each individual has a different starting point for what threat is. And I think that's where it becomes logical when you kind of drag it out and realize, like, well, no pain experience is the same, right? Like, so if two people have the same x-ray or same MRI, that doesn't necessarily mean they're going to have the same pain response. If two people have the same surgery, doesn't mean that they're going to have the same, kind of rehab from it. So I think a lot of times, like when you extrapolate that out, it makes a little bit of sense. but I think to boil it down to how do we keep the threat low, and oftentimes it's how do we get you more in control of the situation.
Mhm. Perceived control is huge when it comes to chronic pain.
Yeah.
And on the flip side of that, something that we call learned helplessness,
Yes.
that
Yes.
goes along with chronic pain. And that the two sides of that coin are really important. And learned helplessness sounds harsh, I know,
Yeah.
but it really just means that you have been conditioned through some experience to expect that you can't, that your
Right.
body can't, or that it won't over time. And that often comes from this idea that I have a perceived lack of control over my body, over the future, over the treatment, over whatever it is, over my basic understanding of why this is happening in my body and what the threat, as you put it,
Mm.
is that that my body's actually responding to. Those two things have to be addressed, and someone has to feel like they have some level of perceived control so that we can lessen that learned helplessness so we can move forward with that individual.
That sounds an awful lot like the terminology for like self-efficacy, which I know I've seen that in the research on the connection and the importance between the patient's self-efficacy and how well they'll do in some type of episode of pain. So self-efficacy being more that like how much do you feel like you can control your own outcome? Like that you don't need someone to fix you, but you actually have the potential to help yourself, and how valuable that seems to be, much more valuable than how what an MRI says or what the actual like structural damage is. So there seems to be much more of an association to someone's belief in self-efficacy, or their actual self-efficacy. So seems very like similar terminology there. Another terminology I've seen is like internal versus external locus of control, which I've it's kind of saying a similar thing, but it's just like you feel like you're in control of your own outcomes. You're not always searching for someone to help you, but you feel like maybe you're looking for someone to help you help yourself in a way. Like,
Mm. Absolutely. The thing about internal versus external locus of control that I think is really important is this idea that um the way I often explain it to people is an internal locus of control is kind of the belief that I happen in the world,
mm,
and versus that the world happens to me is kind of an external locus of control. And so that thinking of internal versus external locus of control as sort of a mindset where this like perceived control is like the action of
right.
that, and that self-efficacy is the action that comes from that worldview. And I think as humans, no matter what's going on with us, whether it's pain, whether it's achievement, whether it's athletics, having a worldview that is more skewed towards an internal locus of control is more helpful in all of these things.
Right.
Now, the one thing we need to be careful about as practitioners is we don't want to move someone too far on that scale,
Mm,
because then the pressure
right.
and the if I don't succeed, then it's all my fault and I can't appreciate the other variables that are going on. That scale starts to get tipped a little bit.
Right.
But overall, having a more internal locus of control, having that worldview is really helpful and important to finding that next step, which is that actionable piece. What can I do to help this situation? What can I do to be an active agent in my recovery process if pain is
Yeah.
what we're talking about?
Absolutely. So, when you're working with clients, practically, like, are there different strategies that you'll utilize to kind of get them to feel like they have a little bit more control, a little bit more self-efficacy?
Yeah, one of the things, because, and I talked about this last time we were on, is that I'm a cognitive behavioral therapist, and cognitive behavioral therapy just to start off, is very scientifically validated for
Mm,
craonic pain on a
right.
very high level. Lots of good studies done. So very, very high level of validation there. So that's one of the reasons I love it for work with chronic pain. But one of the things that we're looking for the most is kind of like, where is the focus? And we do that through automatic thought work and what we call Socratic questioning, which I brought up slightly last time.
Hmm.
But basically that um, I want to know where their thoughts are going on a daily basis as they're moving through things in their life that are difficult, that hurt, that cause them pain. Where are those attributions?
Hmm.
Are we Are they all internal on what's happening in my body? Are they external? Are they about the event that led them to this moment? Starting to kind of identify and tease out what are the thoughts that are going through their head on a regular basis, and where are they focused? And how can we help the individual focus on the ones that they actually have control over and can make changes in to be more helpful, more adaptive, and start to make the ones that are really unhelpful and keep them in this kind of fixed state? How can we make those quieter while making the ones that have actual control possibilities louder for them, and then doing some problem solving work on those ones? What are the actionable steps? But really trying to look at those thoughts, because humans naturally go to the negative. We naturally look for what's going wrong, what's not, in
Right.
my favor here. So how can I also pick out the ones that aren't necessarily positive, but are just ones that have the ability to have actionable steps attached to them that we can work with? So that's one of the things that we do, is really, I will actually have clients on a piece of paper in a notebook on the notes page on their phone, as they're going through their life, they're experiencing pain, they're experiencing moments where they don't have pain. What are the actual things going through your mind, and what are those trends, and how can we look at those trends together?
Cool. Seems like very connected to that would be like the idea of mindfulness. Like you might be guiding an individual's mindfulness of like trying to have them maybe step back, give them some space from the natural reactions, so that they can then see what they actually have control over, versus just letting the external events control them.
Hmm. No, absolutely. And I bring this up a lot, but it is not the situation that makes us think, feel, or behave in a
Right.
certain way. It is our perception of the situation. So what I'm trying to get across is, or what I'm trying to understand from the client perspective is, it's not the signal of pain. It is, how are they perceiving that pain? How are they contextualizing it in their life? And what are they saying to themselves about that pain? That is either making them feel defeated and like they can't do anything about it, or on the flip side of that, making them feel like they can engage with their treatment plan, they can engage with their providers and move forward, and trying to have more of that and less of the former.
Love it. Yeah, I've had a lot of experience with mindfulness over the years, and I was introduced to mindfulness, like about 15 years ago, right before I got introduced to anything with CBT. But I found that at first, like the discussion of mindfulness is almost very much rooted in ritual and spirituality. But as time has passed, there's been a lot more science and a lot more sort of a systematic approach to viewing some of these psychological tools to
Mhm.
help us kind of just view the world differently. And I think one of the things I found with mindfulness, and then as getting introduced to something a little bit with CBT, was just that how things can blend together, right? But ultimately, you have to find the foundations of what is the problem. Like in some ways, life is moving too fast for us. Like we're not able to actually give ourselves enough space to be in control of our own decisions. And that until you actually take some time to practice mindfulness or practice some of these behavioral techniques, you don't even realize that's happening. It's just like you're just being controlled by a force that's outside of you, it feels like. So the connection, or I think this foundation, and what I try to get across to a lot of patients, is that sometimes we have to slow down enough to see, like, are we really want to make this decision? Is what you're saying accurate? Which may be similar to the idea of Socratic questioning, is just like question the logic of the action out of somebody, right? Like, and oftentimes you do that, you start to find that they don't have like a follow-up to enough questions, right? So then they have to actually start to consider some of their behaviors and some of their actions. And on top of pain, like pain, I think oftentimes we have to do that, is ask the question of like, what does this make you feel like? What is the danger that this is creating inside of you? Because there is a lot of assumptions made about pain with people that aren't in the healthcare field. There's just a lot of kind of popular culture mentality around pain, and some of it is actually, I think, promoted by healthcare practitioners, because if you're not dealing with like a symptom on a regular basis, you're just seeing a patient for like 15 minutes here and there. Well, all you can do is give advice that's very baseless, right? Like it's very, kind of, there's no follow up to it. So you don't really get feedback that what you might be telling somebody can create nocivic or like kind of fear producing mentalities that you might have their best interest at heart, but you're not getting the feedback that, okay, well, now they've actually limited themselves way more than they were before they actually came in to see it. So I think you have to kind of question out some of these originally like deeply held beliefs about the idea that pain is the same thing as damage. So as soon as I feel pain, that there's some one thing in my body that can be fixed in this moment, and somebody just needs to find it, and that search will continue until my pain is eradicated. But yeah, I've learned certainly enough. You can't tell people that. So it's the questioning, the backtracking from the questioning often becomes a way for them to learn that there wasn't logic in the process in the first place.
Yeah, and just going back to the mindfulness piece, I think that's really important for a second, is that pain is so all encompassing, and it
Hmm.
can feel like it just drowns out everything else. The thoughts, the emotions, everything becomes secondary to this arousal of pain. And so that mindfulness piece is so key, trying to clear some of that away and get a little bit of an understanding of what are the other things happening here outside of the pain. And a little pro tip for any wellness practitioner is, you made the really good point that while mindfulness, by the way, is extremely well scientifically validated,
Hmm.
again, with cognitive behavioral therapy and other interventions, there has been this association with spirituality over the years. And sometimes if I have a client who I feel is not going to respond well to the term mindfulness, I'll talk about presence
Yes.
and being present of mind. It's the same thing.
Right. Right.
I'm just using another word to say it. And for a lot of clients, that allows that, like, the meditation that often just automatically gets stuck with mindfulness that really doesn't need to be associated. It kind of lets that melt away. And we just talk about being present with thoughts, present with emotions. And I think as a wellness practitioner, it's a really helpful trick when you've got somebody that term just
Hmm.
immediately kind of turns off.
And the simplicity of the idea of mindfulness, I think, is almost condescending to people, right? Like where all you got to do is like literally pay more attention to what's going on, and to like to not like appreciate how hard that is. I think is sort of off balancing to people where you're like, no, I know what's going on in my own life. Like if you have
Mhm.
no experience with mindfulness, you really believe that you know everything that's going on in your own life. But it is different practices like meditation or just discussing things with people where you start to realize like you're not in as much control as you think, and it's a normal state almost, right? Like it's so you actually need a practice outside of your normal life to help you gain a little bit more control of your emotions, of your not even your emotions but your reactions to your emotions, right? And just the separation between like trying to judge things as good and bad and just being with what is. And that couldn't sound more esoteric and spiritual but the idea is that there's a truth to it, right? It's like if you notice it, you sort of make friends with it. And this is where I think the discussion on pain is really important, because pain is useful. Pain is
Mhm.
there's a reason for it. Nobody lives a pain-free life. There is a diagnosis where the name is escaping me of the diagnosis right now, but there is a diagnosis where you are born without pain and you die usually pretty early, because pain is this threat response which you want to listen to. And I like to think of it as it's another sense, right? Like you have vision, you have hearing, you have smell. It's just another sense in the body that's sort of a combination of senses that is
Mhm.
telling you how to respond to something that your body wants you to be careful with. But it doesn't
Mhm.
necessarily want you to stop. It wants you to be careful. Just like if you see something you don't like, you don't stop seeing, right? You don't wish for no sight. You
Right.
use your sight, you use the thing you don't like, and you respond to the environment. If you smell something you don't like, you don't wish for no smell, right? So I think it's kind of fits into that realm. And that's I think like mindfulness of just noticing that pain is present, but pain changes without you doing anything is also a very valuable tool. But we have to be able to slow down and not and stop the search for a pain-free existence to actually notice that it's actually a normal part of human physiology.
No, that makes a lot of sense. I wasn't aware of that diagnosis. That's very interesting. To
Yeah,
look
I
into
have to
that.
look up the exact. it's not one that rolls off the tongue. Let's put it
Yeah,
that
no,
way.
I'm
So
sure
I
it's
always have
not.
to Google it when I'm trying to think. But it's been brought up in many like pain education courses that I've gone to, that that there's this utility of pain. Like we have it for a reason, right? And just you can imagine the obvious example of the withdrawal reflex of touching heat, right? If you put your finger into a flame, if you didn't have pain, you just burn your finger off, right? So, and
Yeah.
that's the difference again between damage and pain. The pain gets there way before the damage and tells you get out of there before it becomes damage. That's an obvious acute example, but we can think of more, chronic pain. It tends to be a little bit more of a lower intensity type of discomfort that lasts for longer periods of time, right? As opposed to this acute type of pain of like putting your finger into a flame. It's going to make you change your behavior real quick, but it's on and off type of thing. So I think when we're looking at chronic pain, a lot of times we're sort of in this middle zone of you're just almost, your body gets used to it, but it also is still trying to eradicate it in many ways. So there's this feeling of a lack of control, because you're like, I've given up on even trying to do anything about it, because this is just who I am, right? You start to identify as like, the pain is me, right? I am a bad back, right? I have
Yes.
a bad back, type of thing.
No, yes. And that is a piece where CBT really comes into play, is when you start identifying with your pain, when you start identifying yourself as broken or damaged, or losing sight of what the future can or will look like because of the pain. How do I move forward from this? How do I envision a life where this is a part of my life? And becoming kind of just, kind of surrendering to the pain in a way as a part of me that is now broken, that I just have to live with, versus again having that self-efficacy to work with our wellness providers to do something about it, which I think, going back to your point earlier, is perpetuated by the medical system.
Yep.
In many ways, when you go in to see a doctor, you're either doing well or you're doing badly. There's
Right.
really no in between. You're
Yeah.
either in pain or you're fine. And if you're in pain, you need a referral, you need this, you need that. And if you're fine, then you're just totally fine.
Right.
That's not how
Absolutely.
human
Right.
existence goes.
Yeah. There's no spectrum there. There's sort of no continuum of like, you know, where you are in the middle there, and I think that's really important. And it's certainly not to poo-poo our healthcare system. I think it's just to look at like, what is our healthcare system and what is it not, right?
Mhm.
And then there's then room for other practitioners or other fields to sort of fill that gap. And I think one of the ways it's been filled is, in our traditional healthcare model, it's looking for a diagnosis of pathology and then trying to have some type of curative agent for that pathology. And the other side of that would be, okay, what does it look like when people are doing well, right? Like, so from a fitness standpoint, like, what does it look like to be fit? What does it look like from a psychology standpoint to be living in a state of well-being, right?
Mhm.
And so something we were talking about, and like, to discuss more, is the idea of positive psychology, which is, the field of study to try to do that, right? Look at, what does it take to live with well-being? So the acronym that I think really speaks, it sums some of it up. I'm sure it doesn't sum it up completely. Would be PERMA, where you're looking at things like positive emotions. E would be engagement with the environment. We could talk more about this. R would be relationships. M would be finding meaning, and then A would be accomplishments. And I think it's a nice little framework of looking at when things aren't going so well, or when you're in a state of pain, is like, are you checking any or all of these boxes that are in this sort of positive psychology realm, to see like, what could I be doing well? I don't have to wait until this pain is eradicated before I start working on actually helping myself, and taking my whole being and putting it into a little bit more of a well-being state.
Absolutely, because the key term here is well-being.
Yeah.
Well-being is not life is going perfectly.
Right.
Well-being is not happiness. Those are not the same terms. Well-being is a global sense of how one is functioning, within the context of the good, the bad, and the ugly, as all humans have. So yeah, no, PERMA is something that I absolutely love, as an acronym to use with clients of my own, and also just a really good framework, as you were saying, for any wellness practitioner that's interacting with any client on pretty much any topic, because when you're talking about the way the body moves, so the way we interact with our world, it's going to touch each of these categories.
Right. So maybe we could break down that acronym a little bit. So we were talking about positivity is the P. And so I remember last discussion you used the term, I think, toxic positivity or something along those lines. And we I mean, you can maybe explain a little bit more about that, but certainly there is that, where you just, no matter what's going on in your life, like everything's positive and you're sort of just steamrolling ahead, and you almost feel like it's forced. But I think what we're talking about with positivity here is a little bit different. So what are some of the ways that you look at that term in general, but how you might try to skew a perspective towards the positive if someone's skewed towards the negative?
Yeah, and I think the real important distinction here, when we're talking, this is Martin Seligman's work,
Right.
when we're talking about the way that Seligman defines this piece, is that it's the experience of positive emotion, not the absence of negative emotions. And humans make that mistake, if I'm having positive emotions, that means I can't be having any negative. That's not the case. In order to live a full life that is, has spectrum in it and depth and has meaning that we'll get to a little bit later, there has to be some moments that are difficult. It just, that's how it has to be. But in order to have a sense of well-being, we need to find opportunities to engage with positive emotions. And one of the things that we do as cognitive behavioral therapists is something called behavioral activations. How can we purposefully schedule things that bring you positive emotions? This is especially important when someone is in pain, because many times things that used to bring them happiness now cause them pain. Things that used to bring them positive emotions. I was working previously with a client who this was absolutely the case for. Pretty much everything they engaged in was physical that brought them positive emotion. Okay, so now what? What do I do with my time? How do I find any level of enjoyment in my life without these things that I was doing before that made me happy? We need to work together to find and identify behaviors, activities, people. We'll talk about relationships in a moment, but things that bring you happiness, and purposefully schedule them into your life.
Yeah.
And be really intentional about that. We call that behavioral activation, which is, because a lot of times pain and periods of depression become, unfortunately tied. And that often happens from isolation, not getting out and doing the things. So something as simple as, okay, what am I going to put into my schedule that brings me some level of positive emotion in a really intentional way, is kind of the building block of how we see positive emotion.
I think that's really helpful. I mean, because the way I kind of have it framed, and that this certainly adds to this framing, would be, if you're in a situation where you have some mindfulness of whatever you're feeling in that moment, or a certain situation that your initial perspective of it is negative, can you give yourself space and look at the other side of the coin? And usually there is another side of the coin. There's an opportunity to reframe something in a more positive light. But sometimes I find that can be very difficult, right? So like it's easier said than done. Like the concept makes sense, but if your mind's not there, you can't force it to be there, even if you do give yourself that space. So actually allowing yourself to, figure out, like, in this moment, what do you feel brings you joy or brings you more positivity, and then get that more into your life. I think that sounds like a better starting point sometimes than trying the reframing of perspective discussion.
Yes, absolutely. Decreasing a negative is a lot more difficult than increasing a positive.
Right.
And if we can start with increasing a positive, there becomes less space for the negative naturally. And then we can start to address, it's not saying we're going to ignore it. We definitely can address it. But if we just don't leave enough space for it by adding this positivity, it makes things a lot simpler. And these are like actionable things that people can do with or without someone like me guiding them along. So it's very actionable for the person.
Nice. I love it. All right. And then E, engagement. This is one I've of late just seen, I think, being a parent and having children that are growing up, and just seeing different ages of children like that, how the difference that I see from my 10-year-old son to say like my mentality now as an adult, I think a lot of it is engagement, but engagement in, you know, he's engaged in certain things, but like anything that he's not interested in, like the contrast between his personality with something he's not interested in, something he is interested in, is stark, right? So trying to be engaged with more things and like approaching it as a learning process, I think is such a valuable tool, but you could see how it's not easy, and how that the things that may be involved in getting somebody better might not be the most fun things to do, especially if it's not like something you're passionate about, but how it is important to find those things that you do want to engage with. And again, the other side of that could be trying to give yourself a little bit of space and say like, all right, I don't love what I'm having to do here, like, but how can I engage with it more? How can I make that important, that I'm not just getting through this, but I'm actually really going to try to enjoy it as much as I can, because I'll get more out of that. And I've seen that to be, again, this difficult place to be, where you can really tell when people aren't engaged with something and they're just trying to tolerate it, and how that could be toxic over time.
Absolutely. And I think as wellness professionals, one of our job, whatever role you are playing with the individual, is to tie whatever the action is that you want them to engage with what is there to bring up something you spoke about earlier. What is their goal? What do they want? And tie that together. That's how you improve engagement. It's not necessarily that they have to like doing, whatever the PT exercise that they hate doing is, but they need to understand why it's getting them to their end point. Why is it going to be helpful for them in pursuing whatever goal they have? How is it in alignment with their values, which is something that I talk a lot about, is how can we align these things with someone's values? And that's really how you increase engagement. And some of that has to, it has to come from seeing the purpose.
Yeah.
Why, understanding the why.
I would say the other thing I like to think about is like almost like a higher end purpose, a higher end why would be, trying to make things like be the type of person who enjoys processes, as opposed to being the type of person that is trying to get to the end for, the end of a goal, and ignoring the process. And I just want to like get the results. Being a learner more than sort of just somebody who accomplishes something. And we'll talk about the value of accomplishment, but I think all of this is tied in, where it's like the accomplishment is necessary sort of in your learning process. But if you can get to the point where learning is sort of your higher power, then it's much easier to engage with everything. And that's certainly a challenge, I think, as a teacher, as a coach, and as a parent. But I do find that to be like one of the things to strive for, right? At least is that you make it more about the process, and you enjoy process. You seek out the process more than you sort of seek out the end game goal, because you appreciate that there is really no such thing as an end game. Like you get to that, and then you can move forward. But I do think that is something that really ties into engagement, whereas like as soon as you become that person who really enjoys learning, it's much easier to engage.
Yeah. And it's especially important when we're talking about chronic pain, because the unfortunate truth is there may not be an end game.
Yeah. Absolutely.
This may be a management situation, and there may be moments in your life where it's better and moments where it's worse. And, the hope is that we can have more of the good moments, but we don't know what life is going to bring. We don't know what's going to go on depending on where the pain is coming, what the source of the chronic pain is. So I think that is especially important in the context of this conversation, because there may not be that end goal.
Absolutely. Yeah. And I think, it's the evidence on chronic pain seems to be like education. A pain education becomes one of the most valuable things you can do. Well, what does that mean? In these studies, it tends to mean like actually educating people against that idea that there is sort of an end game, right? And starting to get more of a sense of like what we were talking about before, that like pain has a utility, and that you have to work with pain throughout your whole life. But just by changing and switching that mentality of saying like you're making friends with your pain instead of trying to eradicate it, you actually now have less pain in your life, but you're also starting to just view it differently, right? And I really think that can't be understated, right? And we can use many different examples here. So you and I both like to work out. We've both done things where we have to move heavy weights. So your body gets sore in an expected way from doing that. And oftentimes the terminology behind that is, oh, it's muscle soreness. But like from a physiological standpoint, that's not a real thing, right? There's not like isolated muscle soreness. There's just soreness that's not threatening to you because you know what it came from in a way, and you had an expectation of it being there. And even if it's more aggressive than you had anticipated, it's usually like still expected, where it's like, oh, okay, like yeah, I'm more beat up than I'm used to from doing this type of exercise. But I think the ultimate idea there is that because it's not a threat, it's much easier to endure and it's expected, right? And it'll ebb and flow. Well, a lot of times pain that would be closer to a joint, it has a similar mechanism in the body. There's some type of response to the body is trying to protect something. It will ebb and flow over time. But because we think of it as like, all right, my joint is now involved and it's not closer to the muscles, or the onset of it was more insidious, I don't know exactly what brought it on. Again, the threat response becomes higher. And we are now looking at it completely differently. And now we are expecting that it should be eradicated, where we wouldn't expect that from this ebb and flow of having soreness after training, because we have some type of control over it coming on. And I do think like having more experience with your body, having different injuries, but also just having different pains in your body, you realize like what's more important is not to be pain-free, but is that you're progressing forward as a functioning human, right? And so then that becomes sort of your purpose more than living a pain-free life, which is not, again, something we talked about is actually something that would be healthy.
Mm-hmm. Yeah, no, makes a lot of sense. Yeah.
So, but so like to speak then, to go into the next discussion, I think a lot of these just tie right into each other. So as you get engaged with more processes, a lot of times you tend to make more relationships, right? And that might be seeking out the help of a fitness coach, that might be seeking out the help of a psychology, behavioral counselor. But sometimes it's then, all right, I'm starting to move more. I'm learning about like health and fitness. I'm going to get into a community of exercise. I'm going to get into a community of, maybe, nutrition and things like that. But oftentimes, positive relationships can come from more engagement if you allow it to happen.
Absolutely. I cannot undersell this one for a whole host of reasons, but especially when talking about pain is isolating.
Yeah.
Pain is psychologically isolating and at times physically isolating, especially if you're used to being able to be active with the people that you care about and the activities and communities you want to be engaged with. And that sense of isolation just breeds hopelessness. And it's a vicious cycle at that point. There's also worked with a lot of clients who get to a place of like, no one understands.
Mm-hmm.
No one can understand, especially if they've interacted with parts of the medical system that have, I see this with women with reproductive pain at times that have basically just completely dismissed their experience of pain over time, and not had their pain validated until maybe very much later in their life, and things like that. That can be, again, extremely isolating and then create trust issues when we are trying to develop those new relationships with wellness practitioners. If in the past you have been dismissed and now you're going to someone new, how are you supposed to trust that they will believe you, for lack of a better term, and validate what's happening with you and work with you to establish some sort of treatment plan? So I think keeping all that in mind as wellness practitioners is really important, but also from the client or patient perspective, working with, if needed, a behavioral health person, a therapist like myself, to understand, what are these walls you're putting up? What do you feel like that's protecting you from? And then also, in what ways is that holding you back from making the progress that you really want to make is really, really, really important. And understanding how you're perceiving these messages that you've received from other people.
Sure. one of the things I wanted to touch on while you just mentioned it is like the idea of having your pain validated. And I think there's a balancing act there of, and like oftentimes like the discussion we're having here about sort of separating out pain from injury, that can be misperceived as saying your pain is not real, right? Like, and people are actually trying to validate the reality of their pain, which is always real. Like if you feel it, it's real, right? And that's, but just to, if you tie it into some type of structural damage, then it's more real, right? So then it becomes more validated, and especially to people that aren't in the know, right, aren't in the field of understanding pain, that does that search for structural damage to tie into their pain becomes a validation, and then it's something you can point to, say, look at my X-ray, it makes sense for everything I've been going through. And so like it's actually, what we're saying is more of the opposite. Like what pain really is, it's always real. It's just a different experience for each person. And you hear the terminology, well, pain is in the head. Well, the pain is always in the whole body, right? So like it never was in your knee, but it's also it is in your knee, but it's in your whole experience as a human. And we like, this isn't necessarily a foreign concept when we understand things like spinal cord injuries and other ways that the nervous system ties into just the feelings in our body, right? Like if you sever your spinal cord, right, like you can't feel things down lower. Like we know this to be true. We've seen examples of this, so we know that there's these connections there. And it shouldn't be surprising now if you've ever seen somebody who had like some type of stroke, right? Like that, that's a brain injury. At that moment, something with the cerebrovascular system has been injured, and that causes symptoms down lower, and sometimes pain is part of that symptomatic presentation. But so we know that there's these connections there, but for some reason, when there is a pain that's like more localized in a joint, it is separated from the idea that it can also be connected to the brain. It can be connected to these other nervous systems. So it's not validated in a way by saying it's from your whole being, right? And I think it's just harder to describe. It's more complex. I get that, but I do think that's part of the search, is that you're searching for validation. And certainly we're trying to do the opposite, I would hope, in this conversation, is saying it's always validated, right? Like you're always being heard, but we just have to give you more control of the situation. We have to figure out how to do that.
Contextualize it.
Yeah, absolutely. And so I think the last thing I'll say on relationships then too is like that these opportunities for learning and engagement, to be able to kind of question, like, who are the relationships that are already there for these individuals, right? And sometimes they're few, they're fleeting, right? Like you said, like it gets very isolating, but can you lean on some people that are very close to you? Because a lot of times I think you can, it's just that you don't want to anymore, right? Like you're afraid to, because you don't want to keep having the same complaints. But if there are like your family and the people that are closest to you, oftentimes they want nothing more than to help. So it's really taking advantage of those opportunities with the people that are already around you. Sometimes you don't even have to seek out new relationships, but as we alluded to, like that can absolutely happen as you start engaging in more processes for health, that you get this secondary social environment that ends up being probably more valuable than the exercise you're doing, right? And I'm very careful not to take people out of the group exercise regimen when they have an injury, unless it's absolutely necessary. Like I want them to be able to kind of work in parallel, right? It's like, do your exercise group, because you're there for a different reason. I don't care like the form that you're doing. I'm going to give you some tips so you have more self-efficacy to know how to modify for you, but keep going, keep attending and work around it, right? And I think one, it keeps the relationships going, but it also is, to me, it's like an assessment process. Like group fitness, a lot of times, depending on how it's done, and that there's people that do it better than others from a kind of an individualized programming standpoint, and sometimes that's just not the goal of the place. But regardless of what the place is, we can load people with education on how to scale for themselves, how to modify for themselves, but the environment to me is more about you're going, you don't feel disabled. You're able to go and you're testing yourself out every time you go to a class. Your training is separate than that, in a way. Your training is more controlled. It's more, like, what you're ready for. And then you kind of throw yourself into a group environment, and you're hopeful in your assessment that you're able to tolerate what they're asking for you, but you're also ready to turn things down on the fly, so you don't have to do what everyone else is doing. But the only time, like, I will really make sure that people take a little time away from it is like if I just don't feel like I trust them to, they just can't calm it down,
Right.
and they just keep coming in with the same complaints. All right, just let's take a
Right.
couple of weeks away from there. But like ultimately, I'd rather them stay in the group environment and work around symptoms and modify than totally take themselves out of it, because it's a lot harder, I think, to get back in them.
Totally. And just to be clear about this, like group exercise is one of those things that like hits all the perma
Right,
pieces.
right,
You
absolutely.
know, like
Yep.
there's a reason that group exercise is so popular, and
Hmm.
it can be so helpful in a person's life because you can get all of these things
Hmm.
from being engaged in a group exercise program. So I couldn't agree with that more.
Yeah, and you get a bunch of annoying physical therapists trying to take people out of it because they're not moving well enough and things like that. So
Right.
and again, that's just, to me, that's not seeing the whole picture, right? And the more collaboration you have, with people that are teachers of group exercise, being maybe a group exercise person yourself, along with being a physical therapist, like, you learn more about that there's not a right. There's
Mhm.
just like, like every situation, every environment has its value, and the collaboration with all of them becomes very vital. But don't feel like you're in this hierarchy where you could take people out of that environment and think like that's the solution, right? So I think, because you don't know what you're actually taking from that person.
Absolutely. No, 100%.
All right. So then, that leads into meaning, right? So I think in these, a good group environment will have a lot of benchmarks that kind of give people that purpose that you were talking about before. Like, that exercise isn't, it might be about weight loss, it might be about something down the line, but even from a movement perspective, it might be about, all right, PRing, right? Getting like the heaviest squat, like that concept might be totally foreign for a lot of people until they get into a group environment class where there's a such thing now as what is your max of anything, right?
Mhm.
Like having that journey to one becomes very valuable in an exercise environment. And we can, there's endless things that you can make meaningful in a group environment. And then, outside of that. But I
Yeah.
think, if we speak about exercise, like, this is one of the reasons I love being in the movement world, because you can use movement to tie into well-being in so many of these ways. It checks all of these boxes. Um, but you can do it sort of without words sometimes,
Yeah.
because it's like, okay, like, these are all the thoughts that you're having, but like, let's see what you can do, and like, we can make it easier, we can make it harder, right? You're actually in control, whether you know it or not, just by letting me know like what you feel you can do, what you can't. And it sometimes surprises people that they can do a lot more than they think, because they had this view of themselves as being so disabled for so long.
Totally. And it just tying back like the actual like definition that Martin Seligman
Hmm.
gives meaning within the PERMA acronym is this sense of purpose, usually outside oneself.
Hmm.
That engagement is more the internal process, and meaning is more how do I connect this to the outside world. And
Hmm.
that's what's so beautiful about group exercise.
Yeah.
One of the program that I teach in here in South Philadelphia is we have this thing called PR Day at the end of every 3-month training cycle. And it's just everyone in the room that wants to be there cheering on their fellow lifters, and, pulling out big presses, big deadlifts, whatever they're working on, whatever specific to them. And that creation of that community, of that cheering people on, that it's not only about what lift I'm doing today, but what my neighbor is doing and how they're feeling about themselves, and the role that I got to play in that by
Hmm.
coming to class every week with them and working on these things, and then being here to cheer them on in this moment. That's so much of the beauty of the meaning part of what group exercise can be, but also like thinking more largely, even outside of group exercise, how do you create more moments like that in your
Yeah.
life where you're engaged with systems, communities, people, projects, whatever it is, that give you that sense of meaning outside of yourself, and how you interact with other people, how you support other people and other causes. That's what creates this sense of meaning when we talk about PERMA. And again, just like beautifully fits in with the group exercise model.
Absolutely. It beautifully fits into kind of what we do for a living too, doesn't it? Really, like so because you can see your clients succeeding, and that just gives you such a meaning in what you do. And it, whether it's what you're doing as a counselor or what you're doing as a strength trainer, like it's there in both environments, I'm sure, and it is for me as a trainer or a physical therapist. So I think that's one of the things that you sort of want to hold some gratitude towards. Like I know it's easy to kind of get burnt out with a lot of the other things about just any job, right? But when you can kind of, not everybody has that opportunity to be involved in helping people try to help themselves, on a regular basis. So.
Absolutely.
And then, so the last letter in this acronym would be A for accomplishment or achievement. I think, kind of they're synonymous ideas. And, it's almost kind of obvious how that, from what we've talked about already, how you start to engage in more situations. You have, more people that are invested in you doing well, right? There's more meaning to that. And then you start to see accomplishments, like maybe you're setting yourself some goals and you're achieving those goals. But it's important, I think, to have goals, but it's also to have them sort of loosely held, where the process is actually more valuable. And you find, like, when you get to the goal, it's not even a big deal anymore, right? Because you went through that process. You're like, yeah, of course I hit this goal because I did the thing, right? So that, like, the accomplishment almost becomes about the consistency of doing the process, where you had maybe identified yourself as someone who wasn't consistent or wasn't a type of person, and now all of a sudden you're confident that you at least have potential to be that at moments, right?
Mm-hmm. And as a cognitive behavioral therapist, goal setting is a huge part of what we do with our clients, because oftentimes people only set the long-term goal. They only set the end goal. But as we talked about in our last conversation, you've got to set the small goals along the way. And sometimes they are process-oriented goals. I gained insight into my pain through this. That is a goal. Gaining insight is a goal. And having fulfilled that goal, a goal might be that you went to your doctor and asked the difficult questions that you were kind of maybe afraid to ask him or her, before. And that is a goal. And you succeeded in that goal by going and having that conversation. It doesn't have to be the end game. And as wellness practitioners, I think it's really up to us to help people see those process-oriented goals, see the goals along the way. Because if the goal is just the end game, man, it is really hard to keep up motivation when you are waiting months and months and months to pat yourself on the back. We should be encouraging people to pat themselves on the back every single day, week, month, whatever it is, and creating those opportunities, because accomplishment breeds positive emotion. Accomplishment encourages engagement. Accomplishment wants to make you engage with those relationships and those meanings. PERMA ties together so beautifully. These things all fold in together. But that can't happen if we're constantly telling ourselves that we're failing.
Absolutely. Yeah, and I think that's a good way to wrap it up. But I think that speaks a lot to what you were talking about, like the last time we had a conversation about, these small victories, right? Like, so it's almost like a reframing of what an accomplishment is, right? Because you can hear it in some language with some clients where, they're constantly like beating themselves up. They, to actually be able to look at things as small victories, as accomplishments, I think that sometimes that takes some doing, but the right environment, I think, can make that easier. And then coaching that, like, celebrate this moment, celebrate, like, you came in 3 times this week, where you've been canceling, and making it just once a week, right? Like, celebrate consistency. All of those things are accomplishments, and sometimes you need a good coach to point that out to people.
Yeah, and one of the things that we learn almost first as therapists is this idea of genuineness. It's a part of, like, the Carl Rogers, like, theory of helping other people. It's like the very basic piece of being a therapist is that the client has to find you genuine in the moment. And so this celebration of accomplishment as wellness practitioners can't be inauthentic. Right. You do have to mean it. You do have to actually care a bit,
right.
and you do have to try to get that across to your client, whatever kind of client or patient it is, in a way that does feel like they genuinely believe you when you are with them in that moment of
Yeah.
accomplishment. And I can't underscore that enough.
Sure. Yeah. Yeah. So like in many ways, like the practice of all of PERMA and all of these like positive psychology things, like to make a good practitioner, like hopefully you're practicing some of them yourselves, right? It's like you're practicing what you're preaching, and I don't know that that's always the case, right? Like where there's sort of I've seen some personalities where like I'm already up here and I don't have to like be working on things because my clients are down here and I have to sort of like get them up to me, as opposed to no, like you want to always be working on things because you're in your own process, understanding that you're trying to get someone else to be in a process too, or guide them in their process. But if you think you're done, then you're not practicing what you're actually trying to get someone else to do.
Absolutely.
All right, I think this was a great conversation, and
Yes.
exactly what I've been looking for a while around the topic of chronic pain, because it is just it's so it the conversation and the discussion a lot of times is more valuable than the treatments, or
Mhm.
it is a big part of the treatment, let's put it that way.
Absolutely.
So being able to just give somebody a podcast, give somebody some educational material on the topic of pain, I think is so valuable, because there's so many misconceptions there, and I think people are often barking up the wrong tree unless they're redirected. So hopefully this will help in that direction.
I appreciate that. Thank you so much for having me again. And I hope we do this again soon.
I can't wait. See ya.
Great.